Hi, my name is Betsy Chambers, and I'm a pre-med high school senior planning to major in sociology and communication studies, which brings me to a STEM topic I'm passionate about: physician-patient communication. This is a STEM topic for two main reasons. First, communication studies is a formal social science, and secondly, communication impacts medicine. I became fascinated with that idea through my work as a simulated patient at a local medical school. This is a program that brings in community members who memorize cases and essentially pretend to be patients for first and second year medical students to practice their clinical skills and patient interaction and information transmission. And so my interest was sparked in what effective communication looks like between physicians and their patients, specifically within the context of pediatrics. So let me step back and define my terms. The American Academy of Pediatrics says there's three main components to effective communication in pediatrics. First, information transmission. Second, interpersonal sensitivity. And finally, partnership building between the physician and the child's caretaker. So I particularly am passionate and interested in the information transmission side of communication in pediatric contexts. So this topic impacts the world because poor communication prevents physicians from doing their jobs well. The American Academy of Pediatrics says effective communication is, quote, essential for effective and efficient routine healthcare. However, that's easier said than done. There's a wide range of health literacies and cultural backgrounds, and we've all had times where we didn't feel heard and understood by a physician, and even ourselves didn't understand. And so this is an important topic because communication does affect health outcomes. And so I want to tell you what I'm currently doing about promoting and working towards more effective communication and what I'm going to do in the future. So currently I've already advocated for more effective information transmission through my work as a simulated patient. I hope to be a tool and a resource for these medical students as they learn communication as part of their education. And in the future, the ways that I want to impact this topic is through research in my undergrad and graduate years and as a pediatrician myself one day. And so research, like I mentioned, I'm interested in research. And so about a year ago, when I got really interested in this idea of communication in medicine, or medicine in the context, or communication in the context of healthcare, I began to read as many studies and research as I could to try and learn. And as I began to read these studies, I began to formulate ideas of my own. And so in this video, I want to tell you about an idea I have for a study that I would love to conduct in one fashion or another in the future. And so I want to identify the key ingredients of effective communication between pediatricians, their patients, and their caretakers. And so I have a hypothesis that pediatricians could benefit from the expertise of professional educators. And so the way that I would test this hypothesis is to select a sample of pediatricians and their patients and have coaching sessions with school teachers or professional educators on what effective communication looks like for children and their caretakers. So the first step of this study would be to establish a baseline score for the pediatrician's information transmission efficacy. So after a visit, I would survey the physician, the patient, and their caretaker and ask them to reiterate what had been covered in that visit. Discrepancies between these answers would be noted, and then a score would be assigned to the physician based on how well the patient and their caretaker had understood. Did they walk away from the visit with that same idea? And then I would additionally survey the physician and ask them, what were your roadblocks to effective communication in that visit? Then I would schedule meetings between physicians and professionally trained school teachers, and we would walk through those roadblocks that the physicians had to patient communication. And my hypothesis is that this cross-disciplinary interaction would result in better physician communication. Finally, I would reconduct that information transmission survey in the same practices, and higher physician communication scores would validate my hypothesis of the benefit of interdisciplinary coaching. By learning from their colleagues in education, I believe physicians could better treat the people before them and not just the bodies they inhabit. And that by improving the communication of even one physician, we could improve the health of hundreds. Thank you.